And Dr. Cole, I want to get into a little bit about the skin care and sun protection during outdoor exercise. Often overlooked, but boy, you read more stories of skin cancer and melanoma and things. And we're going to bring on an expert here coming up in just a couple of seconds. But it's really a critical part of when people think about outdoor exercising, right?
Yeah, I mean, I think certainly on the prevention side, it's important. On the recognition side, it's really important. So people who, they know what to look for. There's a surveillance component, just like breast cancer and prostate cancer, skin cancer requires surveillance. So those are things that we really have to be cognizant of. And look, this is one of those conditions that if you are unfortunately diagnosed with this, the outcomes and expectations are far more predictable with early treatment. So early recognition is absolutely key, and prevention is primary.
Well, our expert joining us this morning is Dr. Stephen Mandrea. He is a board-certified dermatologist and a partner at Lakeview Dermatology. And Dr. Mandrea, thanks so much for joining us here on Sports Medicine Weekly.
Hi, I'm doing great. Thanks for having me.
Thank you, Doc. Hey, aside from using the obvious sweat-proof sunblock, how else does an outdoor athlete protect himself from the elements?
Well, I think I'd just like to say first off that because of the increase in skin cancer and especially melanoma over the last several decades, there are actually over 96,000 new cases that are predicted for 2019, and 57,000 will be in men. So sun protection really, really is important. But sun damage can affect the eyes as well as the skin. So sun protective UV blocking glasses are really important. Sun protective clothing is the best strategy to protect the skin, because then you don't have to worry about reapplying, messy sunblock. And there's all kinds of garments with UPF, ultraviolet protection factor, in the clothing. One brand that comes to mind is Coolibar, Coolibar. Another is Solumbra. But look for a rating of 30 or higher, and this means that the fabric allows 1/30 of the sun's radiation to penetrate. And, of course, hats.
Let me ask you a question. Is melanoma of the eye from exposure, or is that a whole different entity?
It's usually a whole different entity that just like you can get a primary melanoma inside the body, like in the brain, not because of sun exposure. It can happen in the eye. Most of those are not related to sun exposure.
I got it.
But increased sun damage can do, various degrees of the different eye problems.
All right, so let me ask you some just basic question. What you said SPF 30 or more. Is that correct?
Yeah, SPF 30 or more. In general, the higher the number, the longer it's going to last without reapplying. Once you get to 50 or 60 SPF, it doesn't make as much of a difference, because we don't want people having a false sense of security and going, 3, 4, 5 hours without reapplying.
Okay. And should it be waterproof definitively?
Yeah, water resistant, sweat resistant of 80 minutes is usually the best you can do, and then you got to reapply.
Okay.
Our guest is Dr. Stephen Mandrea, board-certified dermatologist, a partner at Lakeview Dermatology, talking about skin care and sun protection during outdoor exercise. And I know our listeners, some of them want to know this, Doc. How do we reverse the signs of skin damage from outdoor exercise, i.e. sun damage and breakouts from sweat?
So some people get a so-called runner's face, both men and women, usually a little older, 40 and above. It can coincide with some fat loss that comes with aging and a lot of exercise and high metabolism, and an increase in wrinkles and skin laxity. So, we do various laser cosmetic filler treatments to help improve a lot of that, but still look natural, not, nothing out of the ordinary or crazy, at least not here in the Midwest. Most people don't want that. And we like to recommend using antioxidants on the skin, like a vitamin C serum, in addition with sunscreen in the morning before sun exposure, because there's evidence that there's less ultraviolet damage when the sunscreen is combined with an antioxidant.
I have another question. I remember when I was at University of Chicago as a medical student, probably one of the first patients I ever had metastatic melanoma, or a melanoma that had spread. And they were doing treatments at the time with I got to remember. It was
probably interferon.
It was interferon therapy, right. And that was considered pretty progressive. So that goes back, let's just say 25 years, right? What, if you fast forward from 25 years ago, are we doing any better, all things being equal, with the treatment of melanoma?
Yeah, the treatment of like metastatic or advanced melanoma has gotten much better with a lot of the monoclonal antibody and biologic medicines that are available, and have been really, in the last decade, there's been a huge resurgence in that area. But you're still talking about extending survival, usually just a couple of years. So by far, the best treatment for melanoma is preventing it to get to that point in the first place, with early detection and surgery for early stage melanomas.
The website is LakeviewDerm.com. Again, visiting with Dr. Stephen Mandrea, board-certified dermatologist, a partner at Lakeview Dermatology. Doc, got to head to a break, but thanks so much for joining us here on Sports Medicine Weekly.
Thanks for having me, guys. And, everyone should have a great summer, but be safe in the sun.
Okay, fantastic. I appreciate it. And let's take a break. We're coming back with a staple of the show. It's our Ask the Doctor segment. Stay with us. You're listening to Sports Medicine Weekly only on
670 The Score.